Good evening, Commissioners. My name is Cheryl Thornton, and I work for the Department of Public Health. I've worked in District 10 for the Department of Public Health for 28 years at Cheryl Health Center, and now I'm at Southeast Health Center. Transportation barriers are often cited as barriers to healthcare access. Transportation barriers lead to rescheduled or missed appointments, delayed care, and missed or delayed medication use. These consequences may lead to poor management of chronic illness and thus poor health outcomes. Transportation is a basic but necessary step for ongoing health care and medication access, particularly for those with chronic disease. Chronic disease can require clinicians' visits, medications, and access change to treatment plans in order to provide evidence-based care. However, without transportation delays in clinical intervention results, such delays in care may lead to a lack of appropriate medical treatment, chronic disease, exacerbation, or unmet healthcare needs, which can accumulate and worsen healthcare outcomes. Many studies have been done and have identified that transportation barriers can lead to early death for those with chronic disease. In addition, San Francisco unit prices have consistently risen and are now up to $3 per ride. The rides provide a transfer that is good for 120 minutes for the time of purchase. If Mini is late or encounters delays that are out of the patient's control, the transfer still expires and the patient has to pay another $3 their trip now costing up to $12 round trip. The Alice Griffin Housing Complex is home to many of the San Francisco Health Network public clinic patients. These patients have to take 2 to 3 buses to visit their provider at Southeast Health Center and 4 buses to get to San Francisco General. Wait times are 10 to 15 minutes for the first bus, the additional 10 to 20 minutes for the second and third bus, and then walk. A low-income household is generally unable to pay $12 for bus fare and commonly becomes fare evaders, causing them to acquire fees and penalties. Our most vulnerable populations need and acquire immediate attention and sustainable solutions on SFMTA equity lines in order to improve their health. I want to say that we have women who come, pregnant women who come, or with their newborn babies who have just had newborn babies. They're on the bus, they're late to their appointments, and then they can't be seen. Many of these patients are Black African Americans. The SIDS rate is highest in the Black African American population. And so we do need change in District 10 for around equity on the lines. I was part of the Cheryl Hill lost their bus about 4 years ago. It was a 53, I think Southern Heights was a community bus that would drive people up. It would go around Cheryl Hill. Cheryl Hill is a very hilly terrain. So people who live down in the public housing in Cheryl Hill really need to take a bus just to get to the top of the hill to the clinic. Well, bus lines were moved, bus lines were removed, and people could not get to the clinic. So we've had some people who probably have lost their life prematurely due to the fact that there is not equity in the bus lines in District 10. So that's what I have to say. So I don't know if there's any questions, but
thank you. Let me ask, and we could address this now or at a future meeting, but are there specific items that you think bring back bus stops or line, but are there specific items that you could think of that would help alleviate some of the issues you've discussed?
Yeah, so many of our patients use paratransit, but paratransit, you have to make an appointment 48 hours prior to the appointment. And if you get sick, if you're diabetic, if your sugar goes awry, you will not be able to use paratransit if you have not booked an appointment within 48 hours. That's the first thing. The second thing is, oftentimes paratransit runs late to the appointments. sometimes they're an hour late. So when the patients get there, we try to see them. Next thing you know, paratransit is back at your door saying, if you don't get on the paratransit now, then you're gonna miss your ride. You have to call in and you might wait there for 3 or 4 hours to get picked up. The other thing is the paratransit card that you get where you you pay $18 for taxi vouchers, and I guess paratransit will match it with $72, so you have a total of $90. The problem with that is if your paratransit card is empty, you have to go to the office. There's no online way to load the card, so they have to go to the office, oftentimes paying regular cab fare just to get to the office so that they can acquire the paratransit card to get the reduced taxi fees. So I think that paratransit needs to be looked into. It needs to be more, it needs to be on time. It needs to be more thoughtful about the patients and how they book them. They need to have an emergency where you can book within less than 24 hours. If you're going to your healthcare provider and you're sick, that's your only means of transportation. And I think the paratransit card needs to be you should be able to load it online versus going to an office.
And as you're saying that, and then I'm thinking about one other thing you said, it struck me that, and Ms. Kirschbaum, tell me if I've got this wrong, the cash fare for Muni is $3, but if you have a Clipper card, it's still $2.50, is that right?
Yes, which is why I said that we're working with MTC on a discounted day pass. We currently only have a discounted monthly pass.
So, and I'll say this so it ends up on the transcript with what Ms. Kirschbaum just said is, which is why they're working with MTC on a discounted day pass. Currently, they only have a discounted monthly pass. So this would be something that someone could pay $5 cash and then have a pass good for a day.
That is the current rate, so it would be a discount on
A
that.
discount below that. And but would you be able to do that with without the clip? Would you still have the Clipper card?
I don't know, I'll
Okay.
ask.
Because I'm hearing like, you know, it occurs to me, I got a Clipper card, it's tied to a Visa card, I swipe it, gets more money when it needs it, and because I can do that. There's other people who can't, and they end up paying cash, so they pay more, and they have to pay twice if they miss a bus, and they have to pay exactly back because they can't get paratransit. So it strikes me that, you know, maybe there's another connection here in terms of, I know why Muni is moving away from the cash fares, but it's probably, you know, it's affecting certain communities in ways that maybe weren't considered at the time that the decision moved away from the cash fare was made. And I see Commissioner Compton.
There's one more thing I wanted to just bring up a point.
Sure.
So, I guess SFMTA is working with Cheryl and Southeast Health Center. It's called the Choice Program. So that program basically is going to take 25 of our patients at Cheryl Hill and 25 of the patients at Southeast Health Center who don't qualify for paratransit to have maybe flywheel vouchers to get to their doctor's appointment. But this problem is so long-standing, to only have 25 patients to be admitted to that program at Cheryl Hill and 25 at Southeast is really not acceptable at this point. So I just wanted to make that point, that I think Choice Program needs to be expanded already. Thank you.
Thank you. Commissioner Compton.
I did